Dr. Moses Ujo Widega Jr., the medical director of the Liberian Government Hospital, Buchanan.
Thank you, sir, for granting us this interview. We here ahead of the president's official visit. We see movement, so we're sure that you are aware that the president will be coming here today to assess the damages that were done. But before we go to all of that, can you give us a brief narrative as to what happened here on Thursday night?
So, as I previously stated, on the 3rd of March, after a long day work, we have doctor that will come and call. That means all of you work, then the doctor pick up the call by 6. So after a long day work, all of us, we are in person, left for rest at my house. So normally when I'm resting, I come back to the hospital to do last round to make sure that the patient are okay again, to make sure that the staff are in position before I go and finally rest. So as the story depicts, I went home and decided to come back at the hospital. So when I got to the hospital around about 8, 9 like that, everything was normal at the level of the hospital. The electricity was on, people were posted. I passed through the ER, I passed through the OB ward and few wards. And went and sat with the chief anesthetic in person of Mr. Macaulay, and we were talking, and in a few minutes the entire lightning system went off. Then I was reminded that the doctor on call were in surgery. So when he told me, it became an emergency, because you can't have people in surgery then the machine just go off like that. So I already came out using the back gate to see the maintenance man, to ask him why the current is off. And Macaulay, ran to the theater. As I pull out, just in the same direction, when I step out, when I looked, I saw fire over the laundry, because this first portion is the laundry. And the fire, when I saw the fire, I started to call for help. I yelled here calling for help, and then I saw the security running to me. And the back gate, I heard people, the young people were there. So we ran to the back gate, and the security man, probably he was confused and he did not bring the right key. So luckily for us, there's a young guy that jumped over the fence and said, "Dash, should I bust the gate open?" I said, "Of course." And he did bust the lock. And the whole crowd came in. When the crowd got in, we started looking for things to quench the fire. But before then, I placed call to the superintendent and also Mr. Gavi Widow of Asla Meta to help us with the tanker. And then he told me that, as considered on the superintendent, I placed a call again. I said, "This is serious." But at that time, the young guys of Grand Bassa, that which I can say thank you to, call come first, they were already on the fire, trying to quench the fire. We have more and more people intruding from the front and from the back gate. But however, we as staff, we needed to protect the hospital first because of the material that we have, because others were not coming with good intention. We had others started checking, breaking through the doors, looking for what they didn't lost. Others were focusing on the fire, and we have a lot of situations that, like, think the superintendent was here too, the chief of medical staff, and all of our staff were on ground to make sure that we protect this side of the hospital and fighting to cut the fire off.
So let's look at the level of damage done to the facility. Where the names of equipment that were damaged, can you give us?
So looking at our own performance at the level of the hospital, we have the laundry that damaged, and the laundry is sort of wash those clothes that the patient wear. Also, while we go to surgery with, all of those things were damaged. The apron, the gown that we wear, the surgical gown, the face shield that we can cover the patient with, they have been kept there, and from there, they all got damaged. When you look at the warehouse, we just received, we have partners that donate to us. We receive drawers in recent time. We receive mattresses, PPEs, for which we brought back here and placed at the warehouse door. All got burned. When you look at the kitchen utensil, everything there got damaged. Moreover, what damaged mostly is the water system. There's a tower there, and you have the system down here that pump the water up to be able to be distributed all to the building. But as we speak, we are now using a hand pump to get water to be able to do cleaning and other things. But right now there is no water system, and the OR has a big electrical problem. So at this time we cannot waste the other building because when the fire service came and they sprayed the water and it was not sufficient, we could not have waited. So I order that indeed, because the fire was coming, as you can see, I order that they should split, they should cut all the barrier to try to disconnect this building, the passageway, with the main building. So they did that, and at least God come first. The young people of Grand Bassa County that had a heart, they were able to quench the fire.
We also heard that the EPR, where all vaccines are kept, they were damaged.
Oh well, the system with the EPR, because I've not seen I've been very busy. I've not seen the supervisor that are responsible for that, so I cannot really speak to that.
Okay, so this fire, we also learned in the past that this hospital was also caught by fire before.
Yeah.
Is this the second time?
So what I can say, this should be the second time, because they are saying the third time, because I can remember I was a medical student here, and we were home, and then the fire incident took place, and we were at Islamata. But those that came to do the wiring, after they did the wiring that day, they tried to test the system, and in that testing, that when the second fire outbreak came.
Okay. So what has been established as the cause, initial investigation?
So
for this fire?
At this time, we have called in because we are not, everybody have their own job description. I can tell you now that it was this and that. What we did as supervisor, we called in the Liberian National Police, and we called in the Fire Service Division of Grand Bassa County to do a thorough investigation. Like last night, yesterday evening, I was at the police station and giving the same thing I stated here, making some written document to the police station.
Have they come up with any funding?
At present, no, there have been no funding yet.
So what has this incident cost the overall operations of the hospital?
So in terms of the overall operation, because just after the incident that night, that same very night, we were able to immediately do cleaning of the facility and started to operate that night, because the main building that we already operate with, it was not tampered with. So there was no need of wasting time. I had to regalvanize my manpower to be able to take our patients off the street and put them back in bed. So as we stand, the immediate problem we have here now is the OR is not operating, because
the OR is the what?
The operating room, where we do operations. So most of our patients now, we are sending them tomorrow, because we want
to Monrovia,
because we want the proper electrician, any that LDC to come and to look at this, because this hospital was established since 1946. Even this building and the wiring system, I don't have idea, but I don't think they are ever in the history of the hospital done rewiring of this particular building. And for that reason, I cannot really say the cause of the fire. But
You talk about some surgical operation being carried out.
Yeah.
That caused the fire while the fire was ongoing.
Yes, yes.
What become of those patients?
So we have one patient there that was in surgery, and we are trained to save life. And no matter how the incident occur, our patient is fine. She is fine. She's walking now and doing well.
Was she the only patient in operation?
Yes, she was the only patient in the
Doctor,
TSC.
in August of last year, the CH Rennie Hospital in Kakata, Margibi was caught by fire, and it raised the concern of fire extinguishers and other fire drills being done at public institutions and facilities. You said the young people came to help in quenching the fire, but here at the Liberian Government Hospital, was there any fire preventive measures taken, like fire extinguishers and the rest in place?
So when I took over, and when the incident occurred, the Ministry of Health have ordered every hospital in the Republic of Liberia to have such a training. We conducted a fire service training. The fire service people came and conducted that training, and they brought fire extinguisher. But that fire could not be used with fire extinguisher. It could not, because I, for one, that saw that fire, if I have not come from my house, then as we are speaking right now, then we have no hospital. But thank God, and you know, we as doctors, we are curious. I hope they hear the news that when anything that goes wrong that is abnormal, you should find what is going on. If we are not being curious, then our whole hospital could have been down. But due to that curiosity, while the current go off, while put in surgery, when I got back, I saw that blaze. It was a disaster, and I needed to call for help.
So that as we speak, there is a power outage now. You don't have power, right?
What?
There's no electricity.
There's no electricity.
No, so we have the solar that was placed there. So the solar is helping us at this time. But for the generator, we are not using the generator because we are scared.
Okay. So when the president comes, what will be your words to him?
So we have spoken as a team, because we dare to save life, we dare to carry on the health protocol. So I, for one, have been against transferring patients. We want to see our hospital to be rewired by professional people. We want to see that the water system be restored, because the water system, with all the water system, we cannot do our work. So the water system be restored, and if we can have the opportunity to speak to the president, I think a short term where we have where we have some thing placed down immediately, because to pay the bidding, we cannot wait to start paying the bidding. So it will have area to have station like the kitchen, like the laundry, and that they will start washing the patient clothes, because you cannot use your bare hand, because RPC business, you cannot use your bare hand to wash blooded material. So all of those things, I think those are immediate things to start operating again in the theater, that we will not send our patient to Morovia.
What about long term? There has been calls for this facility to be modernized, you know, if a new facility can be erected or this one being upgraded. Is that a long-term solution for you? Because this building, as you said, constructed since 1946, that's so many years back. Are you looking for a long-term solution in getting a new and a modernized facility to cater to not just Grand Bassa but the entire region?
So I think indeed our president, in a previous speech in recent time, he still thinks about Grand Bassa, and I think as he comes, we will present that to him, because we already have our area that he broke ground on. I think with passion, I think our new building will start immediately this year. And at least we will have somewhere like 150 bedrooms, and doctors will be having their own, like in Nima, where doctors will be stationed within the hospital, and our nurses and everyone will be in the hospital. So we just pray for the better.
Okay, sir. Thank you. Thank you again.
I'm Dr. Moses Widega, the medical director of the Liberian Government Hospital.
All right, folks. So Dr. Moses Widega there in conversation with us. We also want to give you a closer look on behalf of the Spoon Group of Companies. I'm Diamond Slanger. I'm here with Cyrus Hammond as well. So Cyrus,
Yeah.
this is the second fire incident happening at a major health facility in the country. August of last year, we had the CH Rennie fire incident, and on Thursday of last week, we also did have this happening here in Grand Bassa County. And before you go to your own analysis and all of that, we've had the #1 building in the country being gutted by fire before in 2006, the executive mansion. So someone would say, if the executive mansion, could have been gutted by fire, what much more other facilities? But does that speak to the fact that old buildings in our country, they've not been reassessed, risk management and all of that, including wirings, the roofings, and other hazardous things that could go wrong? Now we're seeing health facilities being the order of the day.
Yeah, so more than 70 years now, this building has been in existence since 1946. So it tells you that this building has outlived its usefulness. So the wiring system, even the facility as a whole, okay, these are arcade facility. So you can clearly say that even though the actual cause of the fire has not been established, you can clearly point to pole or the electrical issues, the electrical fault as a major cause for this fire outbreak. Okay, so as we move on, like 200 years now, we need to look at some of our facilities, our infrastructures. We need to see how best we modernize them. Okay, because look at this facility serving as a major referral hospital here in Buchanan.
And for the whole region as well.
Of course, and this place is very, very populated, Diamond. And so the government needs to think about this very, very critically to see how best they carry on massive renovation. We should not just wait for fire outbreak before we come to renovate or carry on construction or modernization of our facility. We need to carry on assessment of almost all of the facilities, especially those that were constructed within in the 60s, in the 70s, in the 50s, right? You need to carry on regular or evaluation, regular maintenance on these facilities or renovation on these facilities to avoid casualties, right? So it is so good that there was no human casualties here, but the level of damage, the hospital equipment that were here, the beds, the EPR, where they have vaccines in stock here, all of these things got damaged according to the doctor. And so the president will come here any moment from now, and he will carry on his own assessment of this place, and we just hope that, like you already put it, the modernization of this facility is needed. Bassa is a very, very big city in Liberia. Buchanan is a very, very big city in Liberia, so you cannot keep running the major referral hospital in this facility. Okay, so I hope the president will think about that. Despite competing priorities of the government, but health is life.
Health is wealth.
Yeah.
The president in 2021, doing his county tour upon his visit to Grand Bassa County, did break ground for a new Liberian government hospital, 150 bedrooms. But this structure that is still being used until that modern structure can be constructed, completed, and dedicated, this structure has gone through such a serious damage. Though this fire didn't affect the main building, but in a way it has affected the operations of the main building, because if due to this fire incident, Cyrus, there is no electricity flow in the building, and they have to rely on solar powered lights, meaning they are transferring patients now to Monrovia. The distance between Bassa to Monrovia, is a long one, and anything could happen.
Very, very long.
Yeah, on its way. Now we're showcasing as well.
Mind you now, the watering system here has been damaged as well. So listening to him, they are fetching water now from hand pump to supply the hospital, which of course is not supposed to be.
All right, folks, let me be cautious. Cyrus Hammond is here. I'm Diamond Slanger. We're giving you a closer look at the wreckage. Here you're looking at the debris. These walls are all cracked, so I'm not going any closer to these walls. I'm telling you, you have to be cautious. Yeah, these walls are already falling, so this calls for a total reconstruction. You see documents, papers, all there in the far corner, burnt and charred. Beds as well. You can see some materials managed to have been unscathed, but the fire has damaged a lot. Sticks, all charred and burnt. So far there is no electricity being supplied to the building, the major building there. and there is no water supply as well. Those are the water tanks. Their supply pump also got damaged. So we want to take you closer to the other side. We have to watch where we tread. Yeah, watch our steps as well. So President Weah is expected in Grand Bassa County. That's why we are also here early to give you a closer look at what happened, the level of damage. Can we pass inside of this place? All right. So we go into another side. Yeah. So this is a severed pipe. I don't know if this was done during the fire. Can't tell. Yeah, but also, Cyrus, there is a twist in the tale. There are some charters around that this might just be, we cannot have a situation in Liberia that isn't void of politics. There are some charters around that all this was staged, so that the president could come to Grand Bassa and be seen as a savior, during tough times and say, okay, I'll rebuild your hospital for you. I'll do X, I'll do Y, I'll do Z. But also we should take into consideration that the president already did break grounds for another hospital. So was this a needed stunt, as we're hearing from some corners of our society?
For me, Damo, I want to rule that out. Okay, I think this is a disaster that occurred here, and it was not planned by anyone. It was just an unfortunate situation. My opinion, the president has broken grounds for a lot of hospitals across the country. Even in Nima County, there was no fire incident in Sunny Quarter. Okay, and the president went there and broke grounds. In Bopodu City, Bapodu County, for example, there was no fire incident there. The president went and broke ground. Okay, so for people to link this fire incident here to politics, I want to actually disagree with them on that one.
So you're not buying that conspiracy theory?
I'm not buying into that theory at all. I think it's because this facility has lived for a very long period of time. Okay, this facility has been here for more than 60, 70 years. Kind of yes, 1946 up to present. Okay, and so the government itself.
This is the kitchen, right?
Yeah, this is the kitchen.
So folks, we have to be careful again. These sticks, they can fall at any moment. So be careful as to how we're making our way around this place. But this is what remains of the kitchen. Yeah, this is what remains of the kitchen. This is what remains of the kitchen here. So the doctor didn't speak to whether they're feeding their patients even after the kitchen, has been left in ruins.
That's a challenge.
Yeah, this is going to be a challenge as well. So the president is somewhere thereabout on his way. Chairs melted to a great level of damage, and well, maintenance again. These outdated structures, and this is not just a situation happening in Grand Bassa County alone. If you look at our country at large, there are old buildings. Buildings do not have fire escapes. If you look at Central Monrovia, how many buildings do have fire escapes? That if there is an emergency and the stairway is blocked, because we're not going to count elevators now. Many of our buildings don't have. If there is an alternative stair route, for people to use, and these are things that should be included in the building plans. What about fire drills? The doctor did mention that the fire service came to train them on fire drills and all that, but even at our schools, our different public and private institutions, buildings alike, there is nothing like a fire drill. You don't even get to see fire extinguisher and all of these things. But let's talk a bit about the outdated buildings that we have and how hazardous, death trap like many of them are in this country. Sarah, should we now, as the Ministry of Public Works and city corporations as well, start looking into evaluation into the lifespans of these buildings that we have around, so that they don't become death traps for our people?
Exactly. So lifespan of buildings across the country. Even the executive mansion that he's holding initially in 2006 got fired. Okay, and it took the government 12 years for millions of dollars for renovation. 120. Yes.
Just in the early regime.
Yeah, so someone will say that's a really wasteful spending. If at all you are carrying on vigorous renovation or inspection of these arcade building that you want me to say, or carry on renovation or inspection of these buildings and detect some of the problems confronting these buildings. Okay, look at they are saying you see and playing dough on this facility. it tells you that even the wiring system from since the 40s, the 50s, all of these things, I mean, they may have some fault on them. So regular inspection and renovation of archaic building in Liberia is very, very necessary. I think the Ministry of Public Works now should be taking in that direction rather than waiting for the fire outbreak to occur before you move in to say, oh, we are sorry, we'll renovate. So prevention is better than cure.
So they say.
So the government need to be thinking about these methods. Maintenance of public facilities across the country. The regular maintenance of public facilities. Very, very essential to the growth and development of this country.
Okay, so folks, we still here in Grand Bassa County, Buchanan City to be precise, at the Liberian Government Hospital, a building that was constructed in 1946. Yeah, almost in age with the executive mansion.
Of course.
Yeah. And a tragic fire incident did occur on Thursday night at this facility. Thankfully, there wasn't a loss of life or loss of lives. You know, patient that was in surgery, a female, was saved according to the doctor. There were no fatalities, but this facility is somewhat crippled. They don't have the laundry room anymore. The EPI, the kitchen, all that has been destroyed.
Yeah, and the fire was trying to extend to the main facility, but with the help of the young people of Buchanan City, according to the doctor, they helped to extinguish the fire. So that's a very good initiative on the part of the young people, at least trying to come in, move in quickly to see how best to save the rest of the facilities from the fire. That's very commendable, Damo.
Yeah, very commendable, and that's what we see in most of our communities whenever there is an incident of fire, due to the slow response, if not non-show of the fire service as well, but community dwellers do a lot. So folks, these are beds that got burnt as well, and this is where we leave it, waiting for the arrival of His Excellency Dr. George Manenwia, who's coming to this facility to do a first-hand tour and an assessment of the damage of this building, the damages done to this building. So Sarah Salmon is here from Fabric for the Spoon Group of Companies. I'm Diamond Slanger. I'm here for Spoon FM and TV as well. Thank you so much for watching. We'll go live once the president arrives. So Sarah says he doesn't buy into the conspiracy theory that this thing was planned, and so the president can come and play, you know, savior, all of that. But before we go, I see something like a piece of wire there. I want to showcase if that is but yeah. Okay, so this is a metal, not wire. And okay, the doctor says doctors are curious. We journalists, we are curious as well. We are a curious bunch. All right, so this is another foil of metal.
Yeah,
not wire. Yeah. Okay, so all right, folks. Thank you so much. But Cyrus, see the pipe. See how corroded this is. See how corroded it is.
Yeah. So it tells you that the Benny.
Yeah. See how corroded it is. All right. So folks, we'll go live once the president arrives. Thank you again for watching. My name is Diamond Slanger, according to the doctor. Now everybody came with good intentions. Others came, you know, to make her...
Yeah, to loot the facility.
Bye-bye. That works. Bye-bye. Thank you for watching.